Today we're going to look at the Chapter 5 guidelines in the ICD-10 Codebook. This chapter covers mental, behavioral, and neurodevelopmental disorders. The first guideline I want to look at, pain disorders related to psychological factors. The patient has perceived abdominal pain determined to be persistent somatoform pain disorder. In this statement, the physician has stated that the pain is diagnosed as being exclusively psychological. Therefore, no code from category G89 would be added. The word as coders that we need to remember is psychogenic, which means of psychological origin, and that is the term we will use when we are searching in the index for this type of pain. We can find the code either under psychogenic pain or under a pain disorder exclusively related to psychological factors. The key word we're looking for here is exclusive. The rationale is that we would assign this code for pain that's exclusively related to psychological disorders, and if we had thought we might use a G89 code, when you get to the G89 category, there's an excludes one note there that tells you cannot use a code from category G89 along with the code F45.41. If we pay attention to the guidelines as well as the instructional notes, we won't make as many coding errors because we will be following those guidelines that will lead us down the right path. This case has to do with a patient having chronic pain due to trauma. However, there are psychological factors also. The doctor is not saying the pain is exclusively related, but he is saying it's related. There's factors there he can't exclude. So the pain would be your principal diagnosis, chronic pain due to trauma, and then we would have the F45.42 code for that related psychological factors. And the coding guideline tells us that we can use F45.42 along with codes from category G89 because they're not exclusively psychological. This guideline guides the coder when the patient has either a mild substance abuse disorder in early or sustained remission, or the patient has a moderate or severe substance use disorder in early or sustained remission. The guidelines tell us if it's a mild disorder, we're going to classify it to the substance abuse in remission versus a patient with moderate or severe substance use disorder is going to be classified to substance dependence in remission. So the mild disorder, substance abuse in remission, the more moderate or severe substance use disorder, you're going to code substance dependence in remission. Guideline has to do with the hierarchy of use, abuse, and dependence when you're talking about the same substance. The physician dictated the H&P, which states cannabis dependence, but he also wrote a progress note that same day that says cannabis abuse. According to the hierarchy, you're only going to code the dependence because that's the more severe of those two terms. The hierarchy is listed here as well as on the next page. What you're doing is always coding to the more severe of the terms. You can see here the way they're written. But honestly, if I were in the field and a doctor did this, depending on what else is written in the record, I would probably query him or her just to clarify and be sure I was coding the correct thing. It's too important to have a label placed on a patient, so I want to be sure that I'm choosing the correct words. If I chose not to query and I followed the guideline, I would be in compliance, but just I personally would rather query the physician and have clarification. The next guideline has to do with psychoactive substance use when and if it does or does not affect a given situation. If the physician had written that a 27-year-old female tripped and broke her right ankle, her friends reported they were drinking and dancing. It does not in any way state that she has an alcohol abuse problem or dependence problem, so you would not code that. You wouldn't want to add that to this record. What I do want to use this case for is to show you a situation or an example when the index puts us in the neighborhood but not in the right house. In other words, gets us to the right place in the tabular but not the exact code. When you look up fracture ankle in the index, it takes you to S82.89. S82.899-. That last digit 9 is an unspecified code. Fracture of lower extremity unspecified. The information given to us in this scenario is not unspecified. It tells us it's the ankle that's fractured. So as a professional coder, you would go to the S82 category, to the top of this category of codes, to see if I could find a more specific code, and I do. S82.891- is specific to the right ankle fracture, so I have chosen a more specific code. You always want a code with as much specificity as you can. The 7th character A would be used to identify it is the initial encounter, and that 7th character would be added to the S82 code. The next 3 codes that are there are what's called external cause codes. I'm not going to get into them. They're pretty complicated. We'll be touching on those nearer to the end of the semester, but I don't want to talk about those today. In this case, the code for alcohol use would not be coded because it's not associated with a mental or behavioral disorder per the provider's documentation. If we have the same situation, but in this scenario, the physician is stating she had some elevated blood alcohol consistent with her ongoing alcohol abuse. In this case, because the doctor has said so, we would code the F10.10 alcohol abuse code. We'd still have our ankle fracture as our principal diagnosis. We would still have the external cause codes because they are related and they explain what happened. But we would add the alcohol abuse code. If you have any questions related to the Chapter 5 guidelines, please post them in the discussion board and I will attempt to answer them. Thank you so much and have a good day.